I've sought, Minister, to discuss the crisis in staffing the home care sector and government proposals to address this. And the reason I raise this is because I've been contacted, Minister, by quite a number of constituents who are extremely anxious about the current difficulty with getting enough staff to care for people in their homes, in other words, home care workers. We know that we simply do not have enough home care workers at present. We know that hospital patients who are ready for discharge are having to occupy scarce hospital beds because of a shortage of home care workers. In September, at the Public Accounts Committee, the HSE COO, Anne O'Connor, said there are not enough people applying for home care jobs in either the public or private sector. And in some cases, we hear that HSE community organisations are only able to deliver 60% of home care needed. So this is impacting on patients who need home care in order to leave hospital, but clearly it's also impacting on many other people who require care in their own homes. We know that there is a policy, and indeed it's something I entirely support, of decongregation, of moving on from congregated settings, and that's the government's own policy, Minister, as you're aware. But the concern is that the government will simply not be able to move people on from congregated settings, or indeed keep people from going into congregated settings without the recruitment of additional home care staff. And what we're seeing is really a lack of any governmental response to this difficulty. We know that, as I say, I've been contacted by quite a number of individuals and organisations on this. I've been contacted by Home and Community Care Ireland, who tell me their providers are at close to full capacity, and indeed they've gone on record as saying that 8,000 carers are urgently needed in order to look after elderly persons in their own home. I've called for a new fair deal, that we should be adjusting or amending our fair deal scheme to prioritise care for people in their own homes rather than prioritising nursing home and congregated settings. So this is a real concern. But I've also been contacted by people who are themselves carers or who require care themselves. I've got one constituent who tells me they are very upset at current circumstances where their home care package has been compromised to the point where their husband is expected to cover for the person who requires care is expected to cover for home carers unpaid. And indeed, I've also been contacted by a constituent who is herself a carer and who tells me that she's also finding that she doesn't have any security of status as a non-EU worker. So I'm asking, Minister, what the government is proposing to do about this. I understand that due to the exclusion of home caring from the critical skills occupation list prepared by the Department of Enterprise, Trade and Employment, many of those who are currently providing home care and who are from outside of the EU are leaving to work in nursing homes and hospitals. So we need to ensure that there is an overall government scheme put in place to ensure that we can recruit enough home care workers, that if necessary any issues around visas for those who are carrying out home care from outside the EU are sorted out. So the provision of employment permits is one issue, staffing is an issue, but also conditions and pay in the sector is clearly an issue. I should say I put down a PQ on this previously, and I was given a response just on the 9th of November from the Taoiseach Minister of Enterprise saying that a recent review of the critical skills exemption for the non-EEA employment permit system for home care workers, that this review did not recommend removal of the occupation of care worker or home carers from the ineligible occupations list. But if we're not seeing a move towards resolving this issue at that level, Minister, I want to know what is the government doing to ensure that we will have enough supply of home care workers to carry out the necessary care in the home that people like my constituent and his husband so badly require.
And Haddock.
Thank you very much, Cahirlock, and I thank Deputy Bacic for raising this very important matter. And I know the issue of the home care sector is an important issue for the Deputy. Minister Butler and the Government as a whole are committed to developing and improved community-based services in this area, shifting care to the home and offering a greater choice for older people. Last year, an additional €150 million was secured for home support to progress the development of a reform model of service delivery to underpin the statutory scheme for financing and regulation of home support services and to provide 5 million additional hours of home support. The HSE National Service Plan sets out a target to provide 24 million hours of home support this year, and it's estimated that at the end of September, some 15 million hours has been provided to over 53,000 people. This is about 2.2 million more hours compared to the same period of last year. The funding secured in the budget to provide these additional 5 million hours has been maintained from 2021 into 2022. Significant inroads have been achieved in reducing waiting lists for funding approval for new or additional services from over 7,800 in January 2020 to just under 400 in September 2021. This has been achieved through a combination of validation of the waiting list and availability of funding to address those waiting. However, there can be delays between the approval of funding and the delivery of home support hours, and the numbers of people in this category have increased steadily this year. At the end of September 2021, there were 4,933 people assessed and waiting for a carer to become available. In January 2020, there was about 1,300 people in this category. Certain geographical areas that are experiencing increased pressures due to staff availability are particularly affected. Despite the increase, it is important to note that the total number of people waiting for home support across both categories has reduced from over 9,000 at the start of 2020 to approximately 5,300 in September of 2021. The HSE is acutely aware that there are increasing capacity issues across both direct and indirect provision, and it continues to advertise on an ongoing basis for healthcare assistance and recruits as many suitable candidates where possible. The HSE conducts its recruitment through a variety of channels, both at a local level and through the shared service offices of the health business services. Due to the nature of the role of healthcare support assistants, this recruitment is normally conducted at a very local level and is ongoing continually across the HSE. Approved home support providers also continue to recruit home support workers. I would like to advise the Deputy that my colleague Minister Mary Butler has committed to establishing a cross-departmental strategic workforce advisory group, and the role of the group will be to facilitate the views of stakeholders and examine workforce challenges in home support and nursing homes. Potential areas to be considered include recruitment, retention, training, career development and the sustainable employment of home care workers into the future. Work is also going within the department to progress the development of the new statutory scheme to support people to live in their own homes, with a broader context of the Sláinte reforms. Recruitment of the 130 posts funded for the national rollout of the Inter-RAI as the standard assessment tool for care needs is scheduled to commence in this quarter. A National Home Support Office is in the process of being established, and the testing of the reformed model of service delivery for home support commenced this month in one pilot site, with other pilot sites expected to be fully operational by January 2022. Overall, the testing will deliver up to 230,000 additional hours of home support in 2021 and 2022. Thank you, Ciarán.
Thank you, Minister. Deputy has 2 further minutes.
Well, I thank the Minister for the response and for setting out the government's ambitious aspirations, but I think it's shocking that nearly 5,000 people on your own figures, Minister, have been assessed and are still waiting for a carer to become available, and we don't have an indication, maybe you have it available, as to how long they've been waiting. But clearly the lack of home care workers, the shortage of home care workers, indicates there is a recruitment crisis, and that this is causing immense hardship, immense distress and suffering to many of those who are currently awaiting the allocation of carers, and to their carers, the people in their families, their immediate households who may be currently taking on that role. It's also causing immense uncertainty and hardship for the carers themselves. And as I say, I've heard from carers too. One individual tells me she sent emails to many TDs, to media and friends. She notes that the majority of clients are very vulnerable. People need care that we are able to provide now, but because of the difficulties with visa for non-EU workers, this has really caused or helped to cause the crisis. So Minister, the response to the PQ I received tells me that the difficulty is caused by contracts of employment and employment terms and conditions. These are significant factors in the recruitment challenges faced by the sector, rather than a demonstrable labour market shortage. But if that is the case, if the government is saying that there isn't a demonstrable labour market shortage, then what are you doing to sort out the contracts of employment on offer and employment terms and conditions that are being offered offered, because clearly there is enormous demand there. There is an enormous need there for people to have access to home care assistance in their homes. And it's enormously important for all of us that we are moving towards a society where people are no longer required to be sent into congregated settings when they need care, and instead we are providing supports and care for individuals who need it in their own homes. So, I want to be of assistance. I want to try and assist in addressing this serious recruitment challenge, this recruitment crisis, but we do need to see a freeing up of the logjam that's currently blocking people who need access to home care assistance.
Thank you, Deputy. And Tara, for the 2 minutes.
Thank you, Cathaoirleach. Can I say that enabling people with care needs to continue to live independently at home for as long as possible is an absolute priority for this government, and that's why there has been significant inroads in some of those waiting lists. But I do acknowledge almost 5,000 people are assessed and waiting for those hours to be delivered, and that is a distressful situation, I think, for anybody in that situation. But I can assure the Deputy that Minister Butler, and with the support of the government, is making every effort to ensure that those hours are being met and to address the need in terms of recruitment to get those people in situation where they can address those needs, because that is the only thing holding this back. The assessments have been carried out, the defunding is in place, but it's getting that recruitment piece is the last piece in that jigsaw. And as I say, I can absolutely assure the Deputy that Minister Butler is making every effort in that respect. Alongside the significant increase in the level of service provision, the demand for home support and its importance as an alternative service along stay has grown considerably over the years. And I think that demand in some ways is a positive thing, that people want to stay at home independently. Perhaps there was an attitude in the past that people went into nursing homes at a younger age, and I'm glad to see that that doesn't happen anything like it used to, and we need to support people to be able to live at home. The number of home support hours in communities is increasing in line with enhanced investment. It is important to note that despite capacity challenges being experienced within home support services, it is estimated that the overall service delivery has increased by 17% based on the year-on-year activity levels. Efforts are ongoing to meet the continued increased demand for service. In addition, as I mentioned earlier, Minister Butler has committed to establishing cross-departmental strategic workforce advisory group to facilitate views of stakeholders and examining the workforce challenges in support in nursing homes. And that's really to assess and establish why there are those challenges there in terms of getting those additional staff into place. Thank you,
Minister. Item number 2, in the name of Deputy Chair.